And that's Botswana's former president, Ian Khama, speaking there to SABC's international news editor, Sophie Mukwena. Zambia has resumed its vaccination program that was halted about 3 months ago to allow the country to mobilize more doses, but concerns are being raised in the efficacy of the vaccine by citizens. Channel Africa's Arthur Davis Sikopo has more from Lusaka.
Zambia has resumed its vaccination program that was halted about 3 months ago. The AstraZeneca vaccines are second doses being given to those that got the first jabs. But those who intend to get their first shots are being restricted for now to allow only those that had vaccinated earlier to get their second dose and completing their doses. Ministry of Health Permanent Secretary Dr. Kenneth Malama did a symbolic launch at Kalingalinga Clinic in Lusaka today as he got his second jab.
So we are here at Kalingalinga with the World Health Organization country rep, UNICEF country rep, to receive our second dose. When you get your first dose, your antibodies in your system, they are boosted by as much as 89% to 90% with the first dose.
But this resumption comes with concerns from people doubting the efficacy of the jabs, saying it is pointless to be vaccinated if they are still contracting the global pandemic and are getting sick. Ministry of Health social media platform where the announcement was made was flooded with messages. From over 500 comments, many raised concerns on why people that had been vaccinated were still contracting the pandemic and getting sick, while others were claiming that they lost their loved ones to COVID-19 despite them getting the first jabs. A growing number of citizens fear that they are wasting time, while another great chunk feels they will be safer getting vaccinated. I talked to one who had COVID-19 in the second wave before the vaccines were introduced. Later, got cleared and had the jab, but in the third wave, he got attacked by COVID-19 again, despite being vaccinated. Tells me he feels betrayed because information has not flowed as expected for people to understand the matters surrounding the vaccine.
Most of the information that we are receiving right now is the information that I feel was not given to us in the first place before we received the vaccines. So now all these coming together, ringing in my head, I feel betrayed and I feel somehow disappointed to the point that it looks like this vaccine is a trial version and people don't know really, they don't even have the confidence in it to say that once they receive it, what next? So I believe that the medical practitioners should be able to give information that is valid, information that is carrying the confidence in it, such that the clients and the people that are receiving should have hope.
And a medical expert, Dr. Isaac Sakala, states that it is possible for one to get COVID-19 even after being vaccinated, but that it may not hit them hard than a non-vaccinated person.
You introduce an infection, a COVID infection, which is moderate in the body, to prepare the body to mount an enough response of its own, ready to fight that enemy in the body. Once you do that, it does not mean the actual COVID cannot come in. So it means that someone is still susceptible to suffer from COVID. But when that infection comes in, the actual COVID, when it comes in, the body is well prepared to fight it, which will mean that the side effects and how the disease will progress is likely to be not the same with someone who wasn't vaccinated.
In the first round, 142,000 people were jabbed with AstraZeneca, while 6,200 were given Sinopharm. And this round targets 108,000 jabs to be given as the country awaits 120 doses to be received in July.
And yesterday we made a big announcement where government has mobilized resources from the Treasury and also the World Bank has supplemented. And Zambia will be receiving 4.4 million doses of Johnson & Johnson, which is a single jab. And I'm sure as we go towards the end of the year into next year, we are going to see more Zambians vaccinated.
Meanwhile, the country is trending with the increase of COVID-19 cases being detected daily, making bed spaces in health facilities be filled, and some cases are being sent home for community or home management. Shortage of oxygen for patients in critical conditions is also eminent in many health facilities around the country. But the Ministry of Health, through Permanent Secretary Kenneth Malama, is promising that more is being done.
The government has released 40 million kwacha just for oxygen, and we are getting more cylinders. And there are a lot of partners who are giving us support for oxygen. So we are getting commodity secure.
Zambia, a country that records over 3,000 cases daily, today has 20,000 active cases from 134,000 cumulative cases since March 2020. And has so far lost about 1,800 people to the global pandemic. Reporting for Channel Africa in Lusaka, Zambia, I am Arthur Davis, Scopo.
The World Bank has approved a $30 million package to support Malawi procure and deploy safe, affordable and effective COVID-19 vaccines, weeks after authorities complained that they are no longer in stock. Initially, this additional financing